Welcome to our presentation on pre-exposure prophylaxis, or PrEP, for HIV prevention. This session, led by Dr. Adebola Adetiloye, will explore the use of antiretroviral medications like Descovy and Truvada to prevent HIV infection. We'll cover the benefits, regimens, and guidelines for effective PrEP use. PrEP, or pre-exposure prophylaxis, is a preventive strategy involving antiretroviral medication to avert HIV infection. It's recommended for individuals at high risk of exposure and is highly effective when taken consistently. PrEP is a crucial element of comprehensive HIV prevention strategies. Who should consider PrEP? Populations at risk include men who have sex with men, heterosexuals with HIV-positive partners, people who inject drugs, and those with inconsistent condom use. The CDC recommends prescribing PrEP to anyone who requests it, regardless of reported risk factors. PrEP regimens include Truvada for all at-risk populations, Descovy for MSM and transgender women, and injectable PrEP with Apretude for adults and adolescents. On-demand PrEP and the dapivirine vaginal ring offer additional options for specific groups. Truvada, containing tenofovir disoproxil fumarate and emtricitabine, is a widely used PrEP medication. It's approved for all populations at risk and is taken as a daily oral pill. Truvada is over 99% effective when adherence is high. Truvada is FDA approved for MSM, heterosexuals, and people who inject drugs. Dose is one pill once daily containing 300 milligrams tenofovir disoproxil fumarate plus 200 milligrams emtricitabine. It requires monitoring of renal function due to potential kidney effects, such as reduced kidney function and Fanconi syndrome. Truvada is approved for use for those with creatinine clearance. Sati MLR men. Long-term concerns include reduced bone mineral density and hepatitis B reactivation if stopped in those with co-infection. Descovy, another PrEP option, contains tenofovir, alafenamide, and emtricitabine. It's approved for MSM and transgender women, but not for cisgender women engaging in vaginal sex. Descovy offers improved kidney and bone safety compared to Truvada. Descovy is taken as a daily pill, and dose is one pill once daily containing 25 milligrams tenofovir alafenamide and 200 milligrams emtricitabine. Descovy is approved for use in people with ECRCL as 30 ml median. It poses a risk of hepatitis B rebound if stopped in HBV-infected patients. Its safety profile makes it a preferred choice for certain populations. Apretude, with the active ingredient Cabotegravir, is a long-acting injectable PrEP option. It eliminates the need for daily pills, increasing adherence among those who struggle with oral regimens. Apretude is discreet and reduces stigma. Apretude, approved in December 2021, is indicated for at-risk adults and adolescents who are HIV negative. It offers advantages like no daily pill requirement and reduced need for renal monitoring, making it a convenient option for many. Apretude is more effective than daily oral PrEP, reducing HIV acquisition risk by 66-89% compared with daily Truvada in trials. It's administered via intramuscular injection. The dosing regimen includes an optional initial oral lead-in phase, followed by 2 monthly intramuscular injections of 600 milligrams, and then a maintenance dose of 600 milligrams administered every 2 months. On-demand PrEP with Truvada follows a 2-1-1 schedule, supported by international guidelines for MSM. It's used for infrequent sexual activity or when daily dosing is challenging. This regimen involves taking pills before and after sexual exposure. The dapivirine vaginal ring is a PrEP option designed for cisgender women at high risk of HIV, especially in sub-Saharan Africa. This silicone ring releases dapivirine locally over 1 month, providing continuous protection during vaginal intercourse. Dapivirine is not approved for MSM, transgender women, or people at risk through injection drug use. It's approved by the EMA and WHO, but not yet FDA approved in the U.S. It's a self-inserted, discrete option for local protection. The dapivirine vaginal ring offers monthly dosing with minimal systemic absorption. It's a woman-controlled, discrete method, reducing HIV risk by 30–50%. However, it's not effective for anal sex and not approved for MSM or transgender women. This comparison table outlines the main PrEP options: Truvada, Descovy, Apretude, and on-demand PrEP. It highlights differences in formulation, dosing, FDA approval, populations, efficacy, pros, cons, and monitoring requirements. The CDC's 2025 PrEP guidelines emphasize broader access, recommending PrEP for anyone who requests it. Same-day initiation is encouraged if rapid HIV testing is negative, with baseline labs to follow, ensuring timely protection. At baseline, HIV testing, renal function assessment, and hepatitis B screening. Lipid profile is required for Descovy. Ongoing monitoring includes HIV testing every 3 months, STI screening every 3 to 6 months, renal function every 6 months, or more often if indicated, an annual evaluation of triglycerides, cholesterol, and weight for those on Descovy for PrEP. HIV testing before each injection is required for Apretude. Renal monitoring not routinely required for Apretude. Adherence support and pregnancy testing for women are also crucial. Barriers to PrEP uptake include stigma, limited access, cost, and concerns about side effects. Addressing these challenges is essential to increase PrEP adoption and improve HIV prevention outcomes in diverse communities. In summary, PrEP is a proven, effective HIV prevention tool. It should be part of a broader strategy, including condoms and STI screening. Routine follow-up and support enhance adherence and outcomes, ensuring PrEP's success in preventing HIV.